Hi everybody, it's Dr. Ghadir, and we are going to be speaking today with Nichelle Hines, and I'm really excited about that. I hope everyone's had a great day so far, and I'm really looking forward to this talk. I always enjoy speaking with Nichelle. She's amazing, and she is right there, and I'm going to request that we talk to her.
Hi, Dr.
There we
G.
go. Boy,
How
I
are
was
you?
looking forward to this. I got to tell you, I was so excited. I always love chatting, always.
Listen, anytime I get to spend time with you is a great day indeed. I know you have super limited time, so I just want to say I know people are coming in and joining, but as this stuff is coming out about COVID, there's just so many questions that aren't being answered and so many things that are confusing. And obviously, you don't have all the answers yet, but I would love to just have this conversation about where we are sort of so far and what you know and what you think and what your opinion is, because I think it's super important for people to, especially women. How many women are there, that are in a childbearing age that may be having fertility issues or just want to get their eggs together for later or do all of the things. So I wanted to do this talk for anybody out there that wants to have a child, knows someone that wants to have a child, wants anything to do with the child in the next couple of years, and see where you think we need to go and what you think is happening so far.
So I know that we have limited time, but I just wanted to say this. You look so good. You look great.
Thank you, Doc.
Or maybe it's a beautiful smile of yours. It always puts me in a good mood. So I love that. And you do look
always
great.
put me in a good mood,
Thank
Doc.
you.
I think it's just been crazy.
I love that you reached out to me to talk about this, because I've been thinking about this nonstop. And I do agree there's not a lot of answers out there, but I think there's not a lot of answers out there because of the fact that there's not a lot of data, and everything, as you know, is trying to go at the speed of light right now, trying to get a vaccine out there. But as many people know, the vaccine is out there. I saw it on the cover of the New York Times today. People are getting vaccinated now for COVID. But I think there's a lot of areas that we don't know what it actually and its effects are, and that is on, do pregnant women get it? Do people that are going to be pregnant get it? Do people who want to freeze their eggs get the vaccine? And I'm not sure if I have all the answers to this. And I think we're going to have to wait very carefully and ask. But I do believe that if the FDA has approved it, as scary as it may be to get a vaccine against one of the most awful things that has affected our lives, maybe the vaccine is simple and does exactly what it needs to do and will protect us and get our life back to getting towards or resembling normal again soon.
Right. And here was my question too. So I've been reading up on it. And the thing that's really cool, the technology about the vaccine is unlike a lot of other viruses. There isn't the virus in the vaccine. It actually sends a message to kill the virus should you get the virus.
So this messenger technology, which is the way that they're doing this one, is different and new. And just like yourself, I think anyone, like when you're getting exposed to getting immunity, sometimes they give you a live virus that makes you immune. And in this case, I think people would have a lot of fear from doing that. And I think that's why it's so smart that we went this other route.
Right. And that's why it was so fast, right? Because I was reading so much that so many people are like freaked out about the fact that it was so fast. But essentially, because you're not getting the virus, it's sending your body a message to kill the virus. So it's like an assassin. It's like a COVID assassin inside of your body.
It is. It's like a little assassin, just like I have my buddy, Dr. Trevax, who is also on the East Coast, who does exactly what I do and trained with me. He just had his thumbs up. He's a real assassin, by the way. That guy's what you call the assassin, okay? So I think that listen, I've had this thought with myself about, am I going to be getting the vaccine if it's available to me? And you know what? I think that as scared as I am, like Dr. Trevax just said, the COVID assassin, I think we've got to do it. I think we have to try to win our lives back, because not doing it is going to leave too many people at risk. And I have to have enough faith in our FDA that the testing that has been done on it makes it safe enough to at least be able to get it and move on. Now, for the fertility world, I think we're going to need a little bit more data. I don't know what the data is on getting a messenger RNA vaccine into a pregnant woman, because
Right. Wait, now can I ask a question?
sure,
Even before a pregnant
yeah,
woman,
of
would
course.
you feel comfortable going through a fertility treatment with a woman that had the vaccine? Like if someone came into your office in a month and said, Doc, I just got the vaccine, would you feel that it would be safe to go through the process of freezing your eggs or IVF or any of those things knowing that they had the vaccine, or do you think that people should wait? I think that's like the number
So
one
I don't
question I
have
got on
the
my end.
data. So I don't have the data, and this is pure speculation.
Okay.
Okay. But my speculation would be that since we're not giving a live vaccine or a vaccine that includes some of the virus to wake up your body's antibodies, that it takes the process of getting immunity to it, I think that I would be safe getting it. Now, I also don't know, and I'm because I haven't had honestly a lot of time recently to be reading about the newest stuff that came out of the last week, but I
Right.
also do not know how quickly this activates your immunity towards the virus as well. So when you're getting, for example, like, rubella or varicella, those take a while. And it takes a few different booster shots. And I don't even know enough to know if this needs booster or
Okay.
if it does give you, but I believe it's no booster needed and it's a one-time thing. But I'm
No,
not
no,
sure.
it's two. It's two.
Oh, it is two. Okay.
Yeah, it's
So
two. It
I've read
needs a
some
boost.
different things from different companies that are putting it and what it's going to be.
The
Do
Pfizer
you
for
remember?
sure needs two.
And do you know how far apart they have to be?
I think they said 3 weeks because they're trying to get Joe Biden to be fully vaccinated by inauguration. And they said that he needs to get it like before New Year's Eve in order to have the full vaccination.
Wow. And again, like someone just asked, like, how fast can the data be? How safe could the data be if it's only a few
Right.
months? That's a real concern. That is not something that I'm going to pretend does not exist. But
Right.
I'm kind of weighing this out in my head. So I know I'm scared. I'm not 100% sure and have the data that I'd like to have there, like I would with like an influenza vaccination.
Right.
But at the same time, the influenza vaccinations are made in a couple of months every year as well. They find the newest strains, and then they make the vaccines, and we go forward with it as if it's nothing, and we all get the flu vaccine.
That's right. And also, like I was saying before, like you said, because it's not a live vaccine and because you're not actually being injected with the virus, I would imagine that's why they're getting those 90-something% safe. Now, let me ask you another question about vaccines because, like everyone said, it is quick. But from what I've been reading too, vaccines take such a long time too because of the lack of funding, right? So
right.
So it's a bit of a misnomer thinking that every vaccine should take 5 years, 10 years, 15 years, because people aren't funding these vaccines. Whereas obviously with COVID, all the funding in the world is being thrown towards solving this problem, which inevitably speeds up the process, right?
I think people have been working 24 hours a day around the clock trying to make this vaccine. So I think what you're saying is so accurate, Nichelle, that most people don't realize that. Some of the vaccines that we're looking for and the cures we're looking for are with topics that are really poorly funded. They are not the most important thing in the world right now. They are not taking down the entire world with a pandemic. So for that reason, okay, I think it's really, really important to understand that now that this shows us that the technology is there, and I'm not sure at all if just by making things move faster, it's necessarily a bad thing. So maybe this is the way that new things should be developed in the future as well.
Yes. And so I did get some specific questions. Let's see. So you don't have any data yet on whether the vaccine will have shorter long-term fertility effect. But I did read 43 women that were participants are pregnant. They got pregnant after receiving the vaccine.
Wow.
43 women in the test. So
that is telling me a lot. That is telling me a lot about the FDA, and they're thinking that it's completely safe and you don't have to take downtime in being pregnant. Like many of the live viruses that we give people, we tell them they cannot get pregnant for 3 to 4 months afterwards.
Now, by not getting pregnant, does that include going through the process with you? Like, yes, you can't get pregnant, but could you still go through IVF or egg freezing or any of those kinds of things? What up, Mikey?
To this day, exactly. What up, Mikey? To this day, okay, I think that the information about a lot of things that is there for pregnancy is not there for the egg freezing or the making of eggs. So we know that you're not supposed to take certain medications while pregnant. We assume you shouldn't do it while making your eggs. But I really don't think that the data is out there that when an egg is in a capsule inside your ovary, tucked away in a safe location, I don't think that that really pertains to the blood in your female body that is going through your uterus, that's going through the fetus's body, is the same. I don't think the two are the same at all, at all. So I don't know if we can necessarily extrapolate one and say that the other is true.
Right. Okay.
And I don't want to say that because I don't think that, in my heart of hearts, I don't think any of the medications and things you do while making the eggs is really going to affect that egg later on.
That's what I want to hear.
But
wait, louder for the people in the back, Doc. I want you to say that again.
It's almost impossible to do that study. You have to take a group of women and give them the medicine, and a group of women and not give them the medicine, and then use the eggs in the future. How do you know the woman made the same exact kind of eggs? So it's one of those things that we're never going to have a clear answer on that, and we're going to have to assume and try to just guess and use our medical judgment on what's the best.
Okay, so that said, so you would feel comfortable entering into the IVF or the egg freezing process with a woman that had the vaccine?
I personally would. Yes.
That's what I want to hear.
Would.
Okay. All right. I think that was a big one. And so like you said, I want you to say it again because I think women get, obviously it's not a cheap process. And what you said about the egg being protected, and can you say all of that again? I just want everybody to really take this in.
There's a lot of patients that call me and say, like, I'm on an antidepressant. Should I be on the antidepressant during my egg harvesting process? And the thing I say to them is that, first of all, there are some psychiatrists that have done some studies at UCLA that have shown that you're totally fine to be on them. Okay. The reason we just rather err is I tell some of my patients on like ADD medicine, like Ritalin, I say, are you able to function without your medicine? And if they tell me I'm able to function, maybe I'm not as productive, and I just rather not take that extra chance while making my eggs, I'm like, go off of it. But I also have patients that tell me there is no way I can go off of my seizure medicine because I will have seizures and it's life-threatening and it's dangerous. For someone like that, I would say absolutely you stay on your medicine because the downside is huge. So I think you got to take the medicine and how it affects you and your daily life and how you do, and you got to understand if that is the right thing to do for you about coming off or not. Now, for the purposes of this vaccination, first of all, you're not going to be pregnant. So you're just freezing the eggs. And I know that you are my biggest proponent about female empowerment and also telling people to do things to watch out for their future. And I think that's great. And I think for freezing of your eggs, it is probably better to be safe from COVID and trying to do this the safest way you can and protecting yourself and freezing your eggs. So right. I don't think it would be a reason for me to postpone. I think postponing the egg freezing is probably something scarier and more concerning in the future. And if you're going to wait a couple of years to figure out if the vaccination was good, I'd rather you just stay at home and keep working from home and stay safe and come freeze your eggs and not go around people.
Right, because you might lose your chance. What people
Correct.
Forget, your eggs, they get low.
Exactly.
So,
exactly.
Great.
Exactly.
I think that right now is such a tough time, and women need to be assured, reassured. And this really just came to me because the women that I've been speaking to and people curious about their eggs and what they should and shouldn't do. And I know you've spoken to so many friends of mine after the live who, came for consults and are definitely considering the process. And I had this conversation with a client today. If it's something you want to do, don't wait. I would hate for you to lose your opportunity at your dream because you're worried. And honestly, guys, a lot of you have put some things in your body that are a lot more destructive than this vaccine. I'm not trying to be a jerk.
Just saying.
Hi, Chrissy Vane. Chrissy Vane's on here. So guys, in terms of the vaccine, I get that it's scary. I get that it's hard. I'm a woman of color. They put syphilis in black men not that long ago. Was that the 50s, the Tuskegee experiment? And I think that this is for the safety of the world and each other, and for you to even have the opportunity to have a child, for you to be able to do that and all those kinds of things. I think that you have to strike while the iron's hot for that opportunity. And if now is your time, then call Dr. Ghadir. Now is your time. We're running out of time. We have a couple of questions. Here we go. Question: for young women who may be taking birth control or different forms, or going through menopause, or taking the medicine that goes with it, is that all safe and okay to continue? You mean while you're trying to freeze your eggs, Ella, or go into IVF?
Yeah,
wait, you can't stay on birth control and freeze your eggs though, right, Doc?
No. We put people on a week or two of birth control to stop their normal ovulatory cycle and stop their ovulation so I can take over. So
I didn't have to do that.
Once I've taken over, not everyone, but majority of patients go that route. Other people, if you come in for your blood work and ultrasound and everything looks good and your body is not in the middle of a cycle and it's in the beginning, you can go straight into it. But that's the only time that we ever give birth control, and really not much more than that.
Okay. And then this is someone stating a fact, which was interesting, but what about getting the vaccine right before an embryo transfer? So if you're about to get...
I wish I had the answer to that question. And I don't know what the correct answer is there, to be very honest. I don't know. I don't know enough about it, and I don't think there's enough data about it that could tell you that. But if the women in the study that you were talking about, 40-something of them have gotten pregnant afterwards, I'm curious to know and to understand how much after did they get pregnant and how their pregnancies are going. I mean, that would be enough data, and if everything's going normal, I would say it's probably safe, but I would wait to hear some more solid answers about that.
Right. I'm not sure. There were varying degrees of pregnancy, but I know that it was, you know, a pretty large size of women that were pregnant. And as far as they had said so far, that there has not been any reported, but obviously like you, they're waiting. They don't want to say like you're all good. But the sense that I got from what I had heard was that so far so good, you know. I don't think that people, you know, plan to do that. She says also in regards, and they said, thank you for your honesty, Doc. And then wait, for young women, maybe get written, or I'm going to take. Okay, so yes, you can't be on birth control while you're freezing your eggs. Don't worry, you won't want to do anything that'll get you pregnant. You won't want to be doing anything that's going to get you actually pregnant while you're going through this process.
Yeah, it's not really the highest.
It's not the sexiest of things. Let's see. And then, yes, in menopause and taking the medicine that goes with it. So basically what you're saying, Doc, is a lot of this is wait and see, but given the fact that it's got the percentage that it has and the effects that it has so far, that things are looking very good. But if you want to freeze your eggs and you're getting the vaccine, freeze your eggs, especially.
I think to be really honest, our bigger question here is going to be like, how accessible is the vaccine going to be to you and I?
Yeah.
You know, are they going to force me to get it because I work in healthcare? Are you going to be like the last to get it because you're not in healthcare? I mean, I just don't know how even, I can't say I wanted to get it. I honestly don't even know how and where to go to get it right now.
Yeah. I mean, I think, well, right now, nobody's getting it except for special people, but it seems like come like February-ish, March-ish is when you're going to be able to get on the list. You'll call your doctor, you'll call whoever.
There you go. You got it then before me because you're definitely more special than I am.
No. No, I'm getting it last. I did the calculator on the New York Times. They had a COVID calculator. I am number 268.7 million.
I don't believe that.
I promise you. I answered my age, where I live, the county I'm in, and that's what I got. Literally, Ella that's on here, she's only like 24, 25. She's like way ahead. The 35 to 60, we're screwed. But you're a doctor, so it'll happen sooner.
Yeah, I'm wondering. I really don't know. I mean, there's not even enough talk about it that it's out there. I did want to answer that question. Is it safe to get pregnant during the pandemic? If you are not someone who is watching out for yourself and careful and keeping away from people and doing things that like are causing people to catch COVID, I would not get pregnant. If you're someone who's being excellent at quarantining and working from home and staying at home and not needing to do all the things that take your body and your life outdoors, then I would say it's a perfect time to get pregnant. And to be honest, our practice has never been busier. With people working from home and have the flexibility in their schedules to come in and do their ultrasound and not having to go to an office, we have done more egg freezing this year than we ever have, and more IVF as well.
It's amazing.
Yeah.
I want to say something to just to share with you and our audience, especially about COVID. And I'm sure that Dr. Ghadir, you will agree with me that your health and where you're at health-wise is critically important. It's really, really, I had it, full disclosure, in March. I had it very early, right when everything got locked down. I had another friend that had it, and I wasn't really out. I had it, breathing got tough, but I use my lungs. And I have to tell you, if you haven't had it yet and you are not active, it's going to be a lot. So I really, really want you to take your health into account and make sure, guys, not just walking. I have a friend that walked all the time and did Pilates. She was out for 17 days. I teach cycling. It's what I do. I exercise my lungs. I was never really out, maybe a day. I want to just say, for people that haven't had it yet, especially, obviously if you're under 30, it's going to be a much different situation if you're generally healthy. But I did have a rough day, and that breathing, and the first thing that I thought, and everyone that I've spoken to that has had it, that breathing can be very rough on you. I unfortunately had a death in my family of someone who's overweight, and one of my older brothers, you haven't met my older brothers that live there, his wife, they didn't know she had it. And my brother's a widower with 3 children at 48 years old.
Oh my God, Michelle, I'm so sorry. I did not know that.
Yeah, it's not, I don't talk about, but I think it's important to say while we're having this conversation, like you said, if you can be as healthy as you possibly can, and make sure that the people who are on your team who are quarantining, that you guys are very honest with each other, and that if something's happened and you're concerned, go get a test. She thought that she had a light cold. Go get a test. Wow. If you have not had COVID, if you don't know what it feels like, if you haven't had this vaccine yet, if you do not feel well, go get a test.
So, Nichelle, I heard this really crazy statistic that primary care doctors are so not busy because no one wants to get near their primary care doc. And they are also trying to stay away when they catch something, which could be COVID, yes, but they're thinking it's something else. And that's yes, why we're getting these sudden deaths and issues happening.
That's why my sister-in-law is dead. That is why she is gone, because wow, she did not think that she had it, and nobody wants to disturb their doctor. Your life is more important than you being perceived as a hypochondriac. Your life is more important than whether or not you are afraid of whether or not the hospital might be, or the hospital is safe. Like, take your hand sanitizer, put your mask on, and brave it. If you don't feel well, go get a test, because if they can identify it, they can help you.
Right. And there's protocols that the hospitals have put together that you're not going to get sick waiting there. People are careful. They're doing things differently. So don't be afraid if you have to go to the hospital to go to the hospital.
Yes. And any final thoughts, Doc, in terms of like fertility?
Any final thoughts? I want to really encourage people. I think this is a great opportunity that, to take advantage and try to still be as healthy as possible. I know you can't get into the spin studio and sit right in front and be yelled at by Nichelle, but I'm on Zoom. There are other things that everyone can do to be as healthy as possible, and I don't want what I do for everyone else to do and make excuses. So I think it's important for everyone, including myself, to be as active as possible, keep their lungs healthy.
Work
the healthier
those
you
lungs.
are, if you were to get sick, the better you're going to come out of it, and
that's
the better
right,
you're going to be. So, and the least healthy you are is what those people are the ones that should be afraid and are afraid. And we got to make ourselves as a healthiest population we've ever been.
That's
right.
So
I love the topic. It's so relevant to right now. So thank you so much for reaching out and to bringing this important message to everyone. Thank you, everyone, for spending some time with us this evening and learning. Yes. But everyone out there, please be safe. And hopefully we can all resume our favorite activity real soon.
Yes.
At Cycle House with my favorite person. And I'm going to sit in the front row. I'm going to promise right now. When that opens, I'm sitting in the front row. I'm not going to hide in the back. Okay?
Yes. Yes. Now you miss it. Now you'll never take it for granted again.
I know.
I want to say, if you're considering freezing your eggs, if you're considering IVF, if you're considering any of that, I wanted to do this with Dr. Ghadir because he is the best. He took care of me. I have 23 babies in a freezer on Roxbury because of him. He is absolutely incredible. And if there's any help that you need in that arena, thank you for taking the time. I know you're so busy right now in this year, but I want you all to be safe and be healthy, and we love you. And I think that's it. I know you have a heart out at 6 because you're a very busy man.
Happy holidays, everybody.
Thank you
Stay
for
safe.
taking the time,
Thank
Doc.
you.
Bye, guys.
Bye-bye.
Love you. Thanks, Doc.